help pregnant women go through their pregnancy with ease. Yes, I'm also a mother, a content creator, a midwife, and somebody who loves to share her personal story so that others can also learn from. Yeah, so in this video, all that I am going to do is to appreciate our training as Ghanaian nurses. Yes, training and appreciating the training we receive in our beloved country, Ghana. As yes, as a Ghanaian trained nurse who has worked in my country and also abroad. Okay, so somebody will say, maybe Sally, why would you want to appreciate your country? Why would you want to appreciate nursing in Ghana? Okay, yes, leaving the shores of this country to practice elsewhere where you have the opportunity to meet an international community has informed my, like, it has really transformed my thinking, the way I see things, and the way I relate to things. Okay, one of the things that it has affected a lot is my perception about our nursing profession, especially when it comes to our training. So let me just be blunt. I traveled to Saudi Arabia, and in Saudi Arabia you have nurses from India, from Pakistan, you have nurses from America, UK, everywhere. So in Saudi Arabia, you get this international community. Please welcome everybody, welcome everybody. I saw one person who was live. I do appreciate you. So you have this international community. I remember the first day we went as Ghanaian trained nurses and Nigerian trained nurses. When we were left in the ward, I mean, the Saudis were shocked. Okay, our first day, they realized that those of us coming from Africa, especially Ghana and Nigeria, we were already, a lot of us were really, we were already equipped with the basic skill: pass catheter, set a line, give IV fluids, know what to do before a doctor comes, like take our sample and do everything independently. It was a shock to them. It was really a shock to them when they realized that, okay, these are nurses from Ghana, these are nurses from Nigeria, but we really did not need a lot of help. Okay, within a short time they made us to start going for night duty, but then there are some people that when they come, they'll keep orientating them, and you wonder whether the orientation will never finish. But we, the Ghanaian trained nurses, and even the Nigerian trained nurses in Saudi, they really saw the difference. They saw that we were up to task, okay, when it came to our skills. Yes, so within a short time, that's why they said it is good to travel. I was one person who was not really interested in leaving the country, and so when I went there, and then some things happened, and my thoughts were confirmed, and I decided to come back home. But then, before I came back home, I got to realize that I got to, how do I say, I started appreciating nursing in Ghana, our training, the quality of nurses we have. When you go out there, that is when you realize that in like we are really doing well in Ghana. Okay, so I met some colleagues from other countries that I cannot mention. Okay, but if you know, you know. I know a lot of Saudi nurses are also following this page, and if you know, you know. Okay, yes. So a lot of them, you meet them, and when it comes to the practicality, you'll be surprised. Like, you will be shocked. You will be shocked, not like just shocked, but you'll be shocked to your bones. Okay, about the quality of nurses. You even ask yourself, like, did this person really pass through the 3 years or the 4 years or even the 2 years nursing training? Okay, because if you look at the quality that the nurses from Ghana, from Nigeria, and from even those that they call developed countries, developing country, a lot of these their nurses lack a lot of skills. Okay, so this video in particular is just to appreciate. Okay, please subscribe to my channel. It's just to appreciate the training we receive in Africa as Ghanaian nurses, and the Nigerian nurses were not bad at all. Okay, we are good, we are skilled. So if you are a midwife or you are a nurse and you are traveling to Saudi, maybe you are watching my video for the first time, you want to know how it's going to be, please, when you go, be confident in your skills. Be confident. Don't be like, oh, okay, I'm coming from Ghana or I'm coming from Nigeria. Just know that your skills that your teachers have taught you, they are on point. The only issue we had as Ghanaians, okay, or maybe Nigerian trained nurses, was that they had some equipment that it's not like we have even heard of it, because our teachers will teach you. They'll tell you that in Ghana you are improvising, but they'll teach you the right thing. Okay, and so when your teachers teach you and then you go and see it, within a short time you adapt. Okay, and if you're a young nurse, okay, coming up, who is thinking of traveling abroad to go and practice, my advice to you is that try and work in some of the bigger facilities. Don't just be comfortable in a small corner, or like because you want to go to the international standard. Get to some of the district hospitals, regional hospitals, and work there. Go through the pressure, go through the stress. By the time you get to these international places, the only thing you would have to learn is their policies. Okay, you just have to learn their policy. You just have to learn how they you just have to learn their policies. You just have to learn little things, and then you are good to go. Okay, and so I just came live to say that if you're a Ghanaian nurse, if you're a Nigerian nurse, and you have the skills, you really practice in your hometown before you traveled, do not look down upon yourself. You are an amazing nurse, you are an amazing midwife. And I would like to add this particular thing. I really saw some people who, especially the Nigerians, they are leaving Nigeria to go and study in Filipino, and I'm like, what is happening? What is happening? Is it just about traveling, or like you really want the skills? If you want the skills, stay in Nigeria, stay in Ghana, or leave Nigeria and come to Ghana and come and study. But I'm going to Filipino to go and study nursing. Me, I don't think that I would advise you to do that. Okay, I know this is the internet, but I will not advise you to leave Nigeria and go to Filipino to go and study nursing, because I've worked with Nigerian nurses. They are good, and most of them were trained in Nigeria. They are excellent. Okay, unless of course you are not getting admission in Nigeria, in one of the good schools in Nigeria, or you want your friend is saying traveling experience. I haven't seen Ghanaians doing that, and I'm happy. Okay, there's no point. Recently I saw a lady who left the US to come and study nursing in Ghana. Amazing. Okay, amazing. Okay, and you see, a lot of times they have made us not to have faith in our system. But I'm happy I just traveled to go and see what is outside there, and then I came back. Okay, I realized that we do not have everything, but it is not that bad. It's about being on our leaders to do what is right and to provide the things that we need as nurses. Okay, and to improve the standard of living. But when it comes to our training as nurses in this country, it is not bad at all. The only thing that we lack is, okay, we improvise too much. So government should provide, the hospital should provide, everything should be provided. Okay, but when you travel out there and you are thrown into, you are thrown, you join other people, you realize that being a Ghanaian nurse, you have leverage. Like, you can easily go about them. I remember when I went to Saudi, they call something, they would rotate you from one place to the other. Okay, when it's 10 minutes, I'm stopping, so I'll close very soon. They'll rotate you from one ward to the other once in a while. So when my head nurse was sending me to the other ward, she said, Sally, as you are going there, don't behave like you know anything. Just behave like you're a new nurse, you don't know anything, so that they don't give you so much work. Oh my God. So it was like, when we came, you are already a competent nurse, you know a lot of things, so you are always working, you accept the duties that they give you, okay? And so they get a bit surprised. And so when she was sending me to the other one, she was like, please, when you go, just calm down, just watch them, don't be too hardworking so I don't give you much, okay? And so I'm just trying to tell all Ghanaian nurses that be confident, you have the skills. Ghanaians, Nigerians, we just need a little system change. Our government should pay us better, they should provide infrastructure, they should uplift the image of nurses, and we are going to be okay. But please have faith in yourself, believe in yourself, because as Ghanaian trained nurses, there's no place you cannot go, and there's no height you cannot reach. Okay, so that is the motivation I came with this morning. I hope it benefits someone. Please do not forget to subscribe to my page, and thank you for watching. Have a beautiful day. Bye.